Looking at where this is going, do you see conventional medicine embracing this at all? Because it is technology driven. I understand if this was a homeopathic, most of conventional medicine would laugh. But because it's technology, because there's a lot of research around this, like good research, do you see it as something that possibly, along with the drugs they're going to give for Parkinson and develop more and more, dementia, all these things, as an adjunct that they would accept as something to utilize?
I would hope. I mean, the fact that it's lasers, and
Yes.
lasers have been involved in medicine for a long time. And so for a lot of, standard docs, it's not too hard to get involved. The fact of using the lasers, that they're just not used to hearing about it at a stimulatory level. Back to that word photobiomodulation, we're modifying the biology of the cell, with photon energy, but at a very nice stimulatory level, not at a heavy handed. And the biggest problem is going to be getting insurance, to accept something like this. I mentioned earlier transcranial, magnetic stimulation, TMS, that has taken off in some places because insurance will pay for it. And I've heard from plenty of doctors over the years, well, if I could get insurance to pay for it, I would have that in my practice.
Yes.
And that's our hardest part. And, I talked to a neurodevelopmental neurologist recently, and I said, have you heard of this therapy? She's like, yeah, I've heard of it. I was like, well, do you use it? She says, no, we don't. I was like, is there a reason why? She says, well, we need more research. So I said, okay, well, there's a lot on it actually. If you go look, go to PubMed.gov, National Library of Medicine, and put in transcranial photobiomodulation, you're going to find hundreds of abstract summaries.
Oh yeah.
So I'm optimistic, at least with this therapy.
Yeah.
It is lasers, and they'll have to come up with, certain companies that they're going to have to vet, that it be a certain, way of how it's being done. Evidence-based medicine studies, that old story is not really working out so well for medicine.
No, it's been a long time. We're sicker than
a long time, but same thing. And it's profit driven. And if it wasn't profit driven, it'd be a far different situation. But I would hope in time that this will be involved. And the hardest part is educating the providers. They realize that yes, infrared light can go through the bone on your head.
Yes.
You're crazy. And until people can realize that, I mean, I've given this lecture to a lot of people, and people come and talk to me afterwards like, this can really work. And I'm like, it can. I really can. I know it's hard to believe.
Yep.
I'll have patience. I mean, sometimes when you don't charge for things, people are like, well, that doesn't mean it's worth anything. But we don't charge for the therapy in our practice. Because I really want to encourage somebody just to try it. Like, hey, try this out. Let me know how you feel. If you feel any difference, I said everybody's different and how they experience things. But, versus saying, hey, it's going to cost you $10 to use this helmet, and usually they're here doing something else anyways.
Yes.
Or, doing a therapy. I'm like, hey, listen, and we've talked about the rest of their health problems. Like you might benefit from trying this helmet out. Look into it, try it out. Said it helps you. You can look in, you're looking at purchasing something like that for your family if it's something you want to do for yourselves.
Yeah, absolutely. It's something you could do with.
Try make it available so they can come use it. So
yeah, something you could do with like the laser watch kind of thing that Weber does also, and you just throw it on someone while they're getting an IV or in there somewhere, and that could absolutely help, stimulate some things. For the people that do end up taking it home with them, do you recommend an everyday use of 30 minutes or so?
I do. Yeah.
Yeah.
At least initially, once they've done it for a few weeks, then they can certainly go down to more of a maintenance, depending on what's going on, and how acute or how chronic something actually is. Clearly, if they've had a recent head injury, that's, mild. And that's the thing. People think that you got to get knocked out to have a head injury. You don't, you can whack your head under your deck, under your deck on a weekend. That's a head injury. And that could have impact on you. So, something like that, you want to use it acutely. I would say for some people, as long as they're not experiencing anything negative, up to an hour a day, it could be a good thing. Yeah. And obviously you have an issue with hair on the head, but it can go through it. I mean, if you're bald, you're the best person out there because it's going to penetrate the best, so.
That's the positive of baldness. The first positive I've ever heard.
Yeah.